is Jared Hall. I'm a nursing student at NUR State University in the BSN program, also a nurse here at Baptist Health Madisonville. I'm going to be giving you the first part of our presentation here, which is the review and revision of laboratory's critical alert value policy. And the problem we were addressing is some of the cases here at Baptist Health Madisonville were demonstrating significant lag times between lab inputting a positive value for an organism and the nurse implementing precautions for that organism. This ranged anywhere from 1 hour up to 5 days in some cases. This is obviously a big problem. It increases the risk of transmission to other patients. The nurse that goes in is at a high risk of exposure. Any visitors that go in is at a high risk of exposure. And it goes against current best practice recommendations, which are to implement precautions immediately. Here you see our evidence table. I will only pick out one article here to mention the one in the middle here you see from Ms. Beta. It specifically addresses lag times. It was part of the American Journal of Infection Control. It was the only source we were able to find that specifically addressed this issue. The rest of these go towards best practice guidelines, effectiveness, discrepancies between isolation and actual practice, things like that. You see here our purpose during the project was to determine the cause or causes for delays and then to hopefully be able to propose a solution. And ultimately, we want to reduce or eliminate these lag times, but that's really outside the time frame of this project, so we'll have to wait and see. What we found, we resorted to interviewing staff. We interviewed a total of 20 staff nurses. Of those 20, 13 were able to recount specific examples of lag times. Of those 13 lags, 12 were traced back ultimately to deficient or insufficient communication between lab and the nurse. It had one that was due to education that nurse that was unaware that a particular organism warranted isolation precautions. That will be addressed separately outside of the project. And also you can see here one of the key factors in this lack of communication was lab was inputting values into the system. They were made available to the nurse, but the nurse wasn't able to take a break and check a lab report or get into their computer, or in some cases lab reports are actually down. Just in the last couple of days we've had issues at Baptist Health with computer systems, and you were unable to access labs electronically. It was only by paper or over the phone. Here you see a breakdown of these, and you will see that 92+% of the delays that we uncovered were related to the lack of communication. And as that was the overwhelming majority, we decided specifically to address that lack of communication. And the way we chose to try to address that was to propose a change to the critical alert value reporting policy to add all of the isolation organisms to that policy. So immediately upon a positive test result, they would be phoned to the nurse. Our preliminary work has resulted in 2 of those organisms being added, specifically influenza and one other. We still have a further revision that's under review. We drafted it. It involves more than a dozen different organisms that are seen here, some commonly, some not. But we're hoping to see that implemented as well, because it would be a great tool for the nurse. For the rest of the presentation, I will step out and let Mr. Grogan step in. So, can you give this one?
Hello, my name is Barry Grogan. I'm a student at NUR State University as well. I work at Owensboro Medical Health in Owensboro, Kentucky, and I have the privilege of working alongside Jared Hall in this project. One thing I did want to point out, I was able to review our policy at Owensboro Health, and we have already implemented most of this stuff where we as nurses are contacted immediately by staff, by lab, if we get a critical alert value of numerous organisms that we did the research on. Some things I'm going to talk about today is the evaluation process and some recommendations. One thing that we did find once we got into the process, we found out that there was no data collection tool in place at Baptist Health to even monitor lag times. So, as Jared already stated, and I'm going to reiterate that staff had to be interviewed to result came up to the time the nurse was notified. And we also found that there was very little data available, even in professional journals, regarding lag times with these organisms. However, we was privileged to find one study specifically in the American Journal of Infection Control, and they had the same opinion that we had found, and it was lack of communication was the primary reason for between the time that a positive result was found out to the time that staff was notified. And we also, during our proposals, we also made a simple proposed revision, and we hope it's effective once it's in place. During our evaluation outcome, we had some short-term effects. One of our short-term effects was revision of the critical alert policy, which included additional 2 organisms to be added to isolation precautions at Baptist Health. And by these being added, we anticipate this will result in decreased lag times and better patient outcome. So long-term effects that we hope to benefit from this is a more thorough revision of the policy, and at least a dozen more organisms to be added to the policy that will require isolation. And if these are implemented, it's going to further reduce lag times, which will improve patient care. It's going to eliminate staff exposure to organisms, and it's also going to be more beneficial to visitors at the hospital because we're going to have a greater awareness to who's infected of such organisms. Because we had such a short time to do this project, the actual results of the revision remain to be seen. However, we are confident that any kind of policy change will bring us closer to current best practice recommendations. Some recommendations that we do have, one for Baptist Health specifically, is to implement some kind of tracking system that will monitor lag times for implementation precautions. And a recommendation that we would have from our state is we would advise future students that are undertaking a similar project be allowed several months to work on a proposed change at an organization. And for the increased time, that would allow them to be able to determine outcomes for the change that was implemented. In conclusion, again, we found out the problem was communication between lag time and implementation of isolation precautions. And we provided a potential solution for that by revising the policy at Baptist Health of the critical alert value reporting policy. And as of right now, a partial revision has been implemented, while the